Hi, I'm Nathan Young, physical therapist with Yada Yada. Today I'm going to talk about shoulder pain. Is your shoulder bothering you? Do you have a hard time reaching your arm overhead without pain? Does your shoulder wake you up at night? Are you unable to perform your activities? So we're going to give you some basics of shoulder rehab and some causes and some things that can help you along your way. You know, one of the things we look at with common symptoms is, do you have a painful arc? You might ask, what is a painful arc? So a lot of times if you have your shoulder in this position, and sometime when you reach around 60 degrees till you get up to 120 degrees, you have pain. Once you get above that 120 degrees, the pain goes away. If you have pain during that area, that's considered a painful arc, and you might have shoulder impingement or rotator cuff tendonitis. Do you have pain when you're waking up at night? Do you often have pain that's down on the side of your arms? A lot of times with shoulder pain, we call this a referral pattern. And so when you touch your arm here, it doesn't hurt, but whenever you're using it, the pain is referred down to your arm, and that's oftentimes referred from rotator cuff pain or weakness. Some of the other things that we find for common problems with shoulder are poor posture. When you think about things that we do during the day, most of us have this forward hunched posture. What do we do during the day? We are working on our computers, we're on our phone, we're driving, we're eating, we're in this poor posture. We need to be in an upright posture. And so as we are in a poor posture, we get tightness of our shoulder, anterior portion, bringing our shoulder forward, and it brings our shoulder blades, the back of your shoulder, what we call the scapula, out and around in a poor position and causing those muscles weak. So remember, poor posture. Are you doing things in that slumped over posture throughout the day? That will lead to tightness and weakness. The second thing we're going to talk about is that scapular weakness. And so we talked about your shoulder blade, which is your scapula. And usually it's in a position like this and wants to rotate up. When you're weak, your shoulder blade rotates out in this angle, and it puts a lot more stress on your shoulder and your rotator cuff. And so when it's in that poor position, that aggravates the shoulder and causes pain. The third common problem is rotator cuff, and you might have heard of what is the rotator cuff. All of us have a rotator cuff, and it consists of 4 muscles. The job of the rotator cuff is to hold your shoulder, the ball, in the socket. And so if that's weak and it's not holding there, it is rising up and pinching. And so your bone rises up and it hits at the top here and often can cause that pain. That is referred to as shoulder impingement or subacromial shoulder pain. One other thing that I want to talk about today is irritability. And oftentimes when we talk about where we should begin with exercises in physical therapy, we refer to how irritable is your shoulder. And so we classify it in 3 things. We have highly irritable shoulder. With that, we want to start with very beginning exercises. And you can see my video on beginning shoulder rehab. The second thing is a moderate irritable shoulder. With that, you want to start doing more strengthening. Oftentimes I use a resistive band called a TheraBand, and you can see those exercises in my shoulder rehab level 2. Our third is a low irritable shoulder. You don't have the strength, but you're not all the way back on the level you want to be. And so if you're that, we want to go and do advanced strengthening. And you can see my video on advanced shoulder rehab. You can also see my video going more in depth on irritability and causes and symptoms and direction. Hopefully this video was helpful to help you start to understand the shoulder and what is causing your pain. As always, if it's more severe than this or not getting better, follow up with your rehab professional. Thank you.